Good morning. Thank you for coming. I'm pleased to be here today to announce new legislation that will allow young people who severely and persistently abuse drugs to receive treatment when they lack the capacity for informed consent. Bill 55, an act respecting secure withdrawal management for young persons, will provide a secure environment for young people with drug addictions so they can safely detox. Before I get into the details, this legislation is not about a teenager who sneaks a beer on the weekend, nor is it about the teenager who sneaks a toke at a party. This legislation is about a small group of youth lost in a world of addiction. It's about those parents and those families who have nowhere to turn, who are desperate to help and are desperate for help, and in some cases to save the lives of their children. The bill has two objectives. The first is to provide treatment, supervision, care and support for young persons under 18 years old who are suffering from addictions to drugs or alcohol in a safe and secure environment. The second purpose is to remove young people from their chaotic lifestyles and assist them with withdrawal. Then, if possible, to actually engage them in the treatment options in a non-secure setting or even back in the community. Bill 55 provides the parents of children with drug addiction an avenue to ensure their child receives care. Young people in this province with addictions issues who are considered to be at high risk to cause harm to themselves or others will benefit from this legislation. Prior to drafting this legislation, extensive, targeted, province-wide consultation sessions were held. Specifically, consultations took place with a number of stakeholders, including young people and their families with lived experience of mental illness and addiction, community-based youth-serving agencies, and Choices for Youth is an example, advocacy groups such as the Committee on the Stand Against Drugs on the Burin Peninsula, the Newfoundland and Labrador Federation of School Councils, the Child Youth Advocate, Aboriginal groups, representatives from the justice system, by which I mean peace officers, police, legal aid and corrections. And also we went out to other jurisdictions where secure management and treatment legislation is already in place. There's been significant support and recognition of the need for this legislation by these groups, and I'd like to thank them for their contributions. The province currently has two 12-bed youth residential treatment centres which were opened in 2014. The Hope Valley Centre, located in Grand Falls, Windsor, provides residential care and treatment for 12 to 17-year-olds with addictions. The centre has 8 beds that are voluntary and another 4 beds which are located on a secure unit. Referrals from parents, physicians, social workers and other healthcare professionals may be made to an admissions committee. This committee, consisting of managers of both youth residential treatment centres, social workers, will base their decisions on information provided and would make a determination as to whether or not a young person meets the criteria for admission to a secure unit. Depriving a young person of his or her liberty in order to undergo medical treatment is an extraordinary measure. As such, Bill 55 balances a young person's need for health care and his or her right not to be detained against their will by establishing strict criteria for admission. These criteria are narrowly focused and specific, and they include the following. The young person is abusing one or more drugs severely and persistently, and as a result is likely to deteriorate. The young person is likely to cause harm to himself or herself or others. A period of secure withdrawal management is likely to reduce the risk of the young person causing harm or of the young person suffering substantial physical or psychological deterioration. The young person is in need of a period of secure detox to facilitate his or her supervised withdrawal from drugs. The young person is unable to fully appreciate the nature and consequence of his or her drug addiction or to make an informed decision. Other available interventions are inadequate in the circumstances, and an order would be considered to be in the best interests of the young person. Where a manager reasonably believes all these criteria, all of them, are met, and with the consent of the young person's parent or guardian, the manager may make an application to the court to seek a secure withdrawal management order. The court order will specify the young person's length of stay at the centre, which may be between 5 and 10 days. This time frame was chosen as it is the average length of time required for a young person to withdraw from drugs. The secure withdrawal management order may be renewed once only for an additional period of up to 10 days if the criteria for admission continue to be met. The health and safety of young people living with mental health and addictions in our province is one of our top priorities, and we all benefit when our young people are given every opportunity to flourish and become productive, contributing members of society. We've heard a lot of stories at the All-Party Committee consultations from youth and their families, and this brought home to me the importance and need to introduce this legislation into the House of Assembly as soon as possible. Bill 55 is a culmination of many years of advocacy. This has involved much hard work by the staff with my department, as well as officials with the Department of Justice and Public Safety, since our government came into office just over a year ago. I appreciate and thank them for their commitment to this legislation, which will help improve the lives of some of the province's most vulnerable young people